Today on Investigate TV Plus, an alarming number of black women in this country are dying during childbirth. I'm Lee Zurich.
And I'm Tisha Powell. How a source of support and advocacy for pregnant women could be a solution.
Plus, there's a need for diversity in the doctor's office.
In the 2020s, to be a first is very sobering.
We examine the efforts to recruit more providers who look like their patients and how it could benefit their health.
And a little girl who longed for straight hair teams up with her mom to encourage other girls and women to love their locks. In-depth stories that inform and inspire. You're watching Investigate TV Plus.
The Centers for Disease Control and Prevention says black women are 3 times more likely to die from childbirth than white women in the United States.
And multiple factors contribute to these disparities, including quality healthcare, structural racism, and implicit bias.
To help address the needs of black mothers, in May of 2023, the Black Maternal Health Caucus reintroduced the Black Maternal Health Momnibus Act. It's made up of more than a dozen bills that address critical improvements necessary to give black women better health outcomes.
One of those bills included in the Momnibus is the Kira Johnson Act, named for a young mother who should have been celebrating the birth of her second child. Her husband now carries on her memory by advocating for other expectant mothers.
My journey to maternal health advocacy has been born out of experience.
In April 2016, Charles Johnson and his wife Kira arrived at Cedars-Sinai Hospital in Los Angeles for a planned C-section to deliver her second child, a son named Langston. Kira would not leave the hospital alive.
My wife was allowed to bleed internally for 10 hours, more than 10 hours.
Since that moment, Charles has become active and vocal in the fight for the maternal health of black women.
It should be a fundamental human right for a mother to give birth to a healthy baby in our country and live to raise that child.
He recently traveled to Washington, D.C. to lobby for the bill named for his wife. The Kira Johnson Act, among other things, would create a 5-year, $50 million grant program at the U.S. Department of Health and Human Services. The grant would provide funding for community-based organizations to improve black maternal health outcomes, including programs providing support for doulas throughout pregnancy and up to 1 year after birth.
That enough is enough, and it's time for mothers and babies to be a priority in our country.
The Momnibus Act does have the endorsement of more than 200 organizations, including the American College of Obstetricians and Gynecologists, the March of Dimes, and the American Heart Association.
The Momnibus Act also includes a bill that would require Medicaid programs to cover doula services. Doulas are trained professionals who provide emotional, physical, and informational support to mothers before, during, and after labor and birth.
A May 2023 report from Drexel University showed black women who received prenatal doula assistance demonstrated better birth outcomes. Reporter Kristen Crowley follows the journey of one expectant mom.
Baby's asleep, I'll get out my special blocks.
It's supposed to be a time of celebration and joy.
You felt a contraction?
It's big, it's right here.
But as Kira Robinson prepares for her 4th baby, her strongest emotion is fear.
My heart rate was really low, my blood pressure was really high, and I was stroking out.
During Kira's last pregnancy, she developed preeclampsia, a serious blood pressure condition that usually develops in the 2nd trimester or later. Luckily, doctors caught her case. Black women have an increased risk of both the condition and its complications, including kidney damage and death. Worldwide, preeclampsia leads to more than 70,000 maternal fatalities every year.
You would have died.
Yeah, I would have died.
Determined not to become a statistic, Kira knew she needed all the help she could get this time.
But this is a food box. I wasn't sure if we can carry all of it.
That's where Tara Irvin comes in.
Good morning. How are you?
She's a certified doula in St. Louis.
So we're just going to kind of, just bounce like this.
Doulas are trained professionals who provide non-medical support to mothers from pregnancy through postpartum.
So this will be a good handout just to go over for you and your husband.
This can include help with birthing plans, breathing techniques, labor, delivery, breastfeeding, and baby care.
I know you like to practice to meditate.
To Tara, the work is deeply personal.
My sister never got the chance to see her son nor hold her son.
At 34 weeks pregnant, her sister Kelly died from toxemia poisoning caused by preeclampsia. Instead of treating her for the condition, doctors sent Kelly home. They thought the 28-year-old had a bladder infection.
It was devastating. You know, we figured we was gonna go home with her and a baby, but unfortunately that was not the outcome.
Is that why you became a doula?
Yes, absolutely. I don't want any family to have to go through what me and my family endured. It was a lot of trauma. I did a lot of things today as far as with my visits.
Nearly 30 years later, Tara has turned her pain into action with Parents as Teachers, a home visiting parent education nonprofit serving nearly 200,000 families across the country. The organization created the doula program in St. Louis in 2019.
Do you know how many doulas are part of your program right now?
We have 4 certified full spectrum doulas a part of our program.
How busy are they?
Very.
But you have to practice self-care.
They teach new and expectant mothers how to advocate for themselves while also providing social, physical, and emotional wellness support.
With this smile, you can lose it.
So far, the program has supported more than 90 births.
How many people do you think are out there who need a doula?
I believe every woman that is pregnant should have a doula.
Dr. Veronica Gillespie-Bell at Ochsner Health in New Orleans agrees.
Having a doula involved in one's care has been shown to improve maternal outcomes, breastfeeding outcomes, infant outcomes. And doulas really work in that birthing space in particular to be advocates for their patients.
It's a job that's more important than ever amid a growing nationwide maternal mortality crisis, particularly among Black women. According to a recent CDC report, they are more than 2.5 times more likely to die from pregnancy-related causes than white women.
Implicit bias is impacting the way that we deliver care so that we are not giving Black women the same quality of care that we're giving other women.
You didn't want to stay in your seat. I understand.
These doulas are on a mission to change that. They serve primarily Black, low-income mothers, a faction more at risk of not having a positive birthing outcome. And while barriers like cost and lack of insurance coverage can limit access to doula services, this program is free.
I think that is the game changer. Women who would not have access to doulas or even know that it is an available resource to be able to get a doula at no cost is life-changing.
If every person had a doula, what kind of impact do you think that would have on positive birth outcomes?
It would move us much higher up the rung. We would have women surviving birth more, and our babies would see their first birthday and beyond.
He doesn't need any blankets, any bumpers that go along the crib.
Surviving her pregnancy and delivering a healthy baby was Kira's top priority. And after our interview, she accomplished just that, welcoming a baby boy with Tara by her side.
It's always going to be scary no matter what number pregnancy it is. It's always going to be scary, but the support is the support that you need, during delivery that is so important.
Support from doulas like Tara, who know just how high the stakes can be for families.
It was horrible, and we don't want anybody else to experience that type of pain. So by telling my story, telling the story of my sister is a way for me to give back and hopefully save the life of another woman. And we're not letting her death go in vain.
As of January 2024, 12 states and Washington, D.C. have implemented Medicaid coverage for doula care, though reimbursements vary. 9 states are in the process of implementation, many of which will begin their doula Medicaid care at some point this year.
A new tool can use artificial intelligence to determine your true age.
Still to come, the medical mythbuster shows us how Mayo Clinic doctors are using this technology to help you live longer.
But first, too few black men are becoming doctors.
And the interesting thing was that 0 African American men applied for it.
We examine the efforts to recruit more physicians who look like their patients and show you why it could improve health outcomes.
You can watch Investigate TV Plus anytime streaming online. Get the app for Roku, Amazon Fire TV, and Apple TV. They're free to download.
When black doctors treat black patients, a 2018 study by Stanford University found those patients experience better health and lower mortality.
But a 2023 report from the Association of American Medical Colleges revealed just 5.7% of the nation's doctors self-identified as black or African American, a concerning number considering black Americans make up about 14% of the U.S. population.
We examine the impact of a lack of black doctors in America and hear from those advocating for more diversity in the healthcare system. Dr. Kevin Carson is a man of first in Georgia.
I am the first African American interventional radiologist.
But growing up in the 1960s, Dr. Carson says he didn't have many role models in the medical field who looked like him.
A friend of mine sent me a scholarship for in underserved communities. And the interesting thing was that 0 African American men applied for it.
Studies show not much has changed since Dr. Carson attended medical school. A 2022 study by the Association of American Medical Colleges found that 5.7% of doctors identified as black or African American. Citing the association's 2019 report, Atlanta's Morehouse School of Medicine says only 7.4% of students who entered medical schools across the country in 2019 were black or African American.
In the 2020s, to be a first is very sobering.
At Washington University Medical School in St. Louis, Dr. Dineo Cabelli is the first black department head. Dr. Cabelli says there are disparities in healthcare impacting people of color. It's something she experienced firsthand while in labor.
I was in excruciating pain and was ignored.
She's using her experiences as a black woman to teach future doctors how to care for everyone, regardless of race.
You don't have to be a black person to deliver this type of care. You just have to understand, what does it feel like to feel isolated or to feel in pain or to feel like nobody believes what you're going through?
And U.S. lawmakers are taking notice, too. Illinois Congresswoman Lauren Underwood, who is also a registered nurse, along with North Carolina Congresswoman Alma Adams and New Jersey Senator Cory Booker, introduced the Momnibus Act of 2023, which includes more than a dozen bills that invest in housing, transportation, nutrition, and other social factors in maternal health. Representative Underwood believes it's important to have more healthcare providers who have similar backgrounds.
As a registered nurse, we know how important it is to have clinical providers that understand the experiences of the patients and communities that they serve, and also sometimes have the lived experiences of those communities.
Public health researcher Dr. Faith Fletcher echoes Representative Underwood. Dr. Fletcher says finding those individuals who have lived and experienced the same things as their patients involves, among other things, transforming the medical education system.
So the approach to this work is really to ensure that all healthcare providers, all medical students receive a medical education that embeds health equity, that teaches them how to be structurally competent.
Dr. Fletcher also believes there are ways of mentoring up with this generation of medical students to improve health equity.
Their experiences and awareness of social issues and police brutality and healthcare mistreatment has really helped, I would say, to enhance our intellectual medical community with the tools and raising things and challenging the current systems to really improve and transform.
Back in Georgia, Dr. Carson's prescription for diversifying medicine starts at home.
A big part of this is putting it in front of our kids and saying, hey, this is something you can do. This is something you can do to support your money, your community. This is something you can do to support your family.
So Tisha, how many Black doctors are needed in the country?
Well, in 2021, the American Association of Medical Colleges concluded the country needs as many as 180,000 more doctors. To increase the number of Black doctors, the experts we spoke to recommend intentional recruitment to develop a more extensive pipeline of applicants and mentorship of Black students. And I think the old saying goes, you have to see it to be it. So when more people see more Black doctors, that encourages kids to say, I want to be a doctor when I grow up.
And I can do that, and I can be just like that person.
Yeah.
So it's important. All right. Yes. All right. Still to come, a little girl was inspired to help others appreciate what makes them unique.
It's a great thing that it's out because it could really help little girls that have Afro puffs.
We introduce you to Amoria and her magic Afro puffs.
But first, a number you can't ignore.
The medical Mythbuster shows you why your heart age may be older than you actually are and shares the steps you can take to reverse the clock.
Our in-depth coverage continues. You can get connected to Investigate TV Plus on all social media platforms. The saying goes, you're only as young as you feel, but on the flip side, can you be older than you look?
In this medical Mythbuster, reporter Viv Williams explores how artificial intelligence helped Mayo Clinic cardiology experts figure out you may have more control over the aging process than you think.
What is it about those people who look like they're in their 40s but are actually much older? Maybe they just have good genes. Well, that could be. But the myth is, if you're not one of those people, you just have to live with it. Well, experts from Mayo Clinic debunk that myth by comparing people's real age to their heart age. They use artificial intelligence to analyze echocardiograms, or ECGs, to determine how old someone is according to the health of their heart. The researchers then compare that number to the real chronological age of their patient.
When the computer is telling us that this individual is older than what this individual truly is in terms of years of age, we have seen that those individuals die sooner.
Dr. Francisco Lopez Jimenez, a Mayo Clinic preventive cardiologist, says that, on the other hand, if the technology determines someone's heart is younger than their chronological age,
those individuals live longer and have less heart attacks and less heart events of any type.
So what should you do if you find out your heart age is actually older than your real age? Well, Dr. Lopez Jimenez says you can narrow or even eliminate that gap by making some lifestyle changes.
It doesn't take long.
Lopez Jimenez says you can make a difference in as little as a week.
What we are doing these days is to use this information to motivate people to change behavior, to exercise more, to stop smoking, to worry less, to work on their stress level.
Lopez Jimenez says by working on those factors, you can reduce the age of your heart and improve overall health. With this Medical Mythbuster, I'm Viv Williams.
Up next, a little girl uses her black girl magic.
Come along with me, and then you will see.
To inspire other young girls and women to embrace their natural hair.
You can watch Investigate TV Plus anytime online. Just subscribe to our YouTube channel at Investigate TV. You can catch stories and full episodes.
For a little girl in St. Louis, the texture of her curly hair became the source of frustration and even sadness.
Amoria Gray was so upset about her hair, she told her mom she wanted straight hair like her friends. That conversation then inspired a discussion about uniqueness, which evolved into Amoria and her mom writing a book about empowerment.
Reporter Melanie Johnson introduces us to Amoria and her magic Afro puffs.
Come along with me, and then you will see how much fun it is to play with me.
It's a book showing the beauty of self-acceptance through the eyes of 8-year-old Amoria Gray.
Amoria. Amoria.
Amoria's Magic Afro Puffs, written by this young author.
It's a great thing that it's out because it could really help little girls that have Afro Puffs.
A personal story birthed into a children's book after Amoria expressed to her mom
it was heartbreaking.
The then 6-year-old did not like the texture of her hair.
This lady just came out of nowhere and was touching her hair, you know, like she was a pet.
It made me feel sad.
I've worked with girls who didn't like their hair and helping them to heal and get through that. So to have my own daughter say that she didn't like her hair and she wanted to have straight hair like her friends, it was devastating.
The pair used the power of words to change her perspective on the hair she was born with. Amoria now sees it as the magic that makes her special.
We're all different and we're all unique.
How do we get to writing a book to make it better?
Yes, we turned that sadness into gladness, so to help inspire other little girls.
The book's mission has evolved into an empowerment movement for kids struggling with self-acceptance.
Mothers have come up to us at vendor events and have shared with us like the book has helped them.
Taking Amoria's affirmations of self-love on the road.
I am loved.
At book signings, school visits, social media, and even on her own YouTube channel.
We could be anything.
Celebrating confidence and fighting back against low self-esteem with her mom and community by her side.
We want girls to be inspired. We want families to be inspired that they don't have to be anybody else but themselves, to love themselves.
National Afro Puff Day is celebrated on September 6th. It was created as an exciting way to show pride in natural hair. And Amoria's book is available on Amazon. And that's it for us on Investigate TV Plus. I'm Tisha Powell.
And I'm Lee Zurich. Thanks for watching. On the next Investigate TV Plus,
the top of the car was ripped right on the welds like a can opener.
Guardrails meant to protect you during a crash could be deadly. We examine the dangers and go in depth with the experts calling for more oversight.